Osteoarthritis in dogs. Osteoarthritis is often of genetic origin in dogs. It appears little by little and it is difficult to detect, because the dog adapts to the pain. In dogs, the joint normally includes the joint capsule, ligaments, cartilage and synovial fluid. The joint is surrounded by tendons and muscles. Cartilage is made up of a complex material which, in adult dogs, is 70% water. Synovial fluid provides nutrients such as glucose, oxygen and amino acids. Cartilage is elastic and absorbs shock. The moving parts are enclosed in the joint capsule filled with synovial fluid which serves as a lubricant and limits friction in the joint. The movement of the joint and the pressure it experiences affect the volume of synovial fluid. Synovial fluid nourishes cartilage and ligaments with nutrients. Cause of osteoarthritis in dogs. Osteoarthritis in dogs can appear without underlying factors or be the consequence of joint disease such as elbow or hip dysplasia, patelloluxation, osteochondrosis or after trauma such as a fracture or rupture of the cruciate ligament. In the latter case, however, the progression of osteoarthritis can be slowed down by means of a cruciate ligament operation. Large and medium-sized dog breeds are particularly prone to it, but it can also affect small dogs. Osteoarthritis can reduce joint mobility due to thickening of the joint capsule or pain from joint swelling. As the disease progresses, cracking sounds, rubbing, are heard as the leg bends and unbends. As the osteoarthritis joint breaks down, the cartilage can wear down to expose the bone, which is painful. The body compensates by building up bone material around the joint to reduce mobility and thus reduce pain when the bones come into contact. The consequences of this compensation caused by the affected joint are sometimes a modified musculature and an overload on other joints. The pain also appears in the muscles, which is more difficult for the dog to manage than simple joint pain. Symptoms of osteoarthritis in dogs. Symptoms of osteoarthritis can vary greatly. When X-raying the hip and elbow joint of a young dog, osteoarthritis can be detected without any other signs. Some dogs with osteoarthritis live without problems for many years. The most common symptoms are lameness and stiffness to varying degrees. Lameness and stiffness are most noticeable when the dog has rested. Lameness and stiffness are reduced as the muscles warm up. Lameness gets worse after activity, games, or hard work. The severity of lameness and stiffness can also vary depending on the season. Due to the pain and stiffness, the dog with osteoarthritis is unwilling or unable to perform certain movements or tasks such as standing up, jumping, climbing stairs and doing an activity such as hunting or that of a working dog. In the early stage of the development of osteoarthritis, it is normal for the dog to limp from time to time. The pain may then be more continuous, even at rest. The pain is visible, as the dog does not seem to be able to settle down properly and changes position often, moves at night and pant. Other possible symptoms: he doesn't want to play or go for a walk. He hurts when touched. He changes his behavior, it licks and bites specific body parts. He is tired. He has less appetite. He is more anxious. When to consult a veterinarian. If the lameness does not improve after 15 days despite rest, or if the dog has the symptoms indicated above without improvement. How is the diagnosis made? Osteoarthritis is characterized by joint pain, reduced joint mobility, filling of the joint and, to varying degrees, inflammation and lameness. Muscle pain is very common with osteoarthritis. A muscle or group of muscles may feel tight or sore as the dog tries to relieve the joint that hurts. With osteoarthritis problems on the hind legs, the back muscles are often tense and sore due to improper loading. After a clinical examination, a thorough examination with an X-ray may help to better understand the problem and its progression. Osteochondrosis, abnormal bone growth, is a cause of osteoarthritis. Some joints are more exposed than others. The most affected joints are those of the elbows, hips, knees, fingers and tarsi. That of the shoulders and carp are less affected. Upon diagnosis, treatment, exercise, and a proper diet can help achieve the best possible outcome for the dog. Medical treatment for osteoarthritis in dogs. One of the important points in the treatment of osteoarthritis is to reduce inflammation. With the right medication, the problems are reduced and the quality of life improves. Some dogs get by without anti-inflammatories and painkillers. What can you do yourself? Exercise for a dog with osteoarthritis. Recommended exercises. To reduce the problem of osteoarthritis and possibly delay its development, The dog should exercise regularly but in moderation. The dog feels better taking several short walks rather than one long one. He should do the same amount of exercise every day of the week with the same routines all year round on soft surfaces. In case of more strenuous exercise or activity, warming up is important to reduce the risk of injury. You also have to think about cooling it down with a calmer walk after a session of more intense physical activity so that the muscles can eliminate all the waste in an efficient way. Never let the dog rest in a cold vehicle for too long or after the walk. A dog with osteoarthritis can move a lot, but the most important thing is to do it gradually. Short walks are great to start with, and as the stiffness goes away and the musculature improves, the intensity can be increased and the walk lengthened. Exercises to avoid. People with osteoarthritis should avoid violent play with other dogs, exercise on hard surfaces, bike rides and other strenuous activities such as ball throwing. A dog with osteoarthritis is often afraid to slip. His condition could deteriorate significantly if he slips. Try to avoid letting the dog rest in places where icy patches can form in the winter. Other exercises for the dog with osteoarthritis. Other possible exercises in case of osteoarthritis in dogs are as follows. Playing paw is a good exercise if the dog has problems with the forelegs. Sitting, standing exercises if the problem is in the posteriors. Course with low obstacles. This exercise can help the dog to lift its legs and do it with more precision. The dog must pass the obstacles slowly, without jumping. Obstacles can be moved up as the dog manages to lift the legs higher. Food and nutritional supplement. Some nutritional supplements contain both glucosamine and chondroitin sulfate, which are the building blocks for new cartilage formation and are found naturally in the body. There are no reliable scientific studies that indicate that a dietary supplement reduces symptoms of osteoarthritis in both dogs and humans. Reduce dog overweight. Increased mechanical load due to overweight can accelerate joint destruction. A study indicates